Hi everybody. I'm for those of you who don't know me, I'm Pastor Paul, pastor at Trinity Evangelical Free Church here on Main Street in Windsor, and I'm here today with Jill Lord. I think everybody knows Jill Lord. Everybody should know Jill Lord at Mount Ascutney. Jill, what's your title? Official title?
I'm the Director of Community Health.
Director of Community Health, and we're here today. We just wanted to talk a bit about the community health needs assessment. And a lot of folks in the community, I think, don't really know what the community health needs assessment is and what it's about, how it's used. And so we just want to take some time today to talk about that. And then also just like what it is, but also just to talk about what do we do with it? How is it helping our community? So how about if we just start off with a question, Jill? What is the community health needs assessment?
So it's a comprehensive process that we do every 3 years, where we devise a series of questions to hear the voice of the community about community needs. There's an online survey that we sent it out, and hopefully a lot of people that are listening to this have taken the survey. That's my hope. And if you haven't this past 2021, I hope you take it in 2024, because we'll be repeating it. And so it's very important to us to hear what the community thinks, feels, and understands to be the pressing needs for their health and the health of their families. So we do a survey online. We send out paper surveys throughout the community. We do intense focus interviews with people that are particularly in vulnerable groups. We have done interviews with the elderly, people with medication assisted therapy, with people from the food shelf, etc., to really dive deep into what the issues are and the problems are. And then we look at the validated health measures, information from the health department, from the census, from the youth risk behavior survey. And then we put all of those together to give a picture of what are the priorities of health needs. We look at, what were the priority health needs in 2015 when we did the 2018 ones? Have we made progress? What are the ones that we look back at 18 when we did 2021? So we compare, and we're using this as a roadmap for our initiatives to improve the community health and well-being. It really is our marching orders. It really serves as the basis of where we need to invest our energy and our time and our work with community partners to make a difference for the health and well-being of the community.
Let me just ask three clarifying questions.
Okay.
One, when you say the community, how big is the community? This isn't just Windsor, right? What's the community that we're talking about?
So it's 13 towns around Windsor. It's the service area of Mount Ascutney Hospital and Health Center. And an easy way to think about it is if you think about the Windsor Southeast Supervisory Union and part of the Windsor Central Supervisory Union. It encompasses those towns.
Okay, second question was, how many people were surveyed? Do you have like a ballpark figure? How many? I mean, because it sounds like we did a whole lot of work. What were the numbers?
Yeah, so let me actually get the numbers, because we spent a lot of time actually reaching out in now I'm turning my head away, so I want to look at you. So I'll just tell you in broad numbers, it was well over 1,000 surveys, probably 1,300 surveys, something like that.
Okay.
That we did. Yeah.
And then the last clarifying question, you were saying we a lot, and that's, and you alluded to it. I just kind of want to emphasize it for those who are watching. The we isn't just Mount Ascutney the hospital. The we is who?
Mount Ascutney working with community partners, because yes, granted, Mount Ascutney Hospital takes the lead in this and organizes and is the backbone facilitator for this process. However, we can't do it in isolation. We work with our community partners from mental health, from social services, really businesses, town municipalities, um, anyone, individuals, and we'll take help from every corner that we can to hear the voice of the community, and to initiate any kind of actions that are necessary as a result of the community health needs assessment.
Even churches, which is why
Even churches.
I'm here.
That's right. Well,
Because
actually, I have to say a lot about Trinity, because you're one of our strong partners around working with you for the food shelf, for our spiritual health group, really for the needs of the community. You worked with us around the needs of housing and homelessness this winter in particular. So we're very grateful for churches. Yes, even
yeah,
and churches.
yeah, no, thanks. Thanks. If folks are wondering why is the pastor doing the interview, it's because we are involved with food insecurity and, as you mentioned, spiritual health, and something near to my heart is just the substance use, substance and alcohol. So yeah, so it's been great to be able to be involved, and it's wonderful. I think it's absolutely wonderful how the hospital wants to have those other voices, whether it's community partners such as myself, or just some of the real more specialized groups who are helping out. So and I had a chance to read it through the community health needs assessment. It's available on the website, right? The
That's
hospital's website.
correct. Yeah.
So man, as I was reading, there's just so much information. What would be for you 2 to 3 highlights? Because I know you've presented it to various groups. What are 2 to 3 highlights that really stand out for you, kind of with your view of the whole needs assessment?
Well, first of all, it's data rich, so
Mm,
you can dive in. If you have a particular interest or need, you can get in there and look at the numbers and look at the percentages and get a clearer picture of our community. And it's also data rich around the demographics. So we get a real sense by looking at information, what are the levels of poverty? What are income levels? What are the levels of vulnerability for folks that live in our area? So it teaches a lot. As soon as I get it, I know I'm a nerd, but I read it with intense interest, and my copy is already, dog-eared, and I use it throughout the year. So that information that we get from it is important.
mm,
But really, it's not the only thing. I mean, information without action is nothing, right? I mean, so you have to take that information and you have to make a difference. And that's what, when I said marching orders, that's what I meant. Really, we have to use that information to spur us to action, to really reverse the negative trends that we see and build on the strengths that we have. And the biggest thing that pops out for me, and it won't be surprise to anybody that's listening to us today, is mental health. The issue of mental health is just people struggling with anxiety and depression, and the overlay of COVID with social isolation and fear, and also keeping people away from healthcare. There was a fear in the beginning, and people weren't getting their regular health checkups. So that mental health piece is critical. And the other thing is, if you look at 2018 and you look at 2021, mental health was the top health priority. And so, our CEO has done a tremendous amount in reaching out and recruiting psychiatrists. We're building supportive relationships with HCRS. We have an embedded HCRS clinician in both our pediatric and our adult clinic, and we're reaching out to form relationships about new ways to decrease anxiety, provide education, workshops on how to help build coping skills. So mental health is the first thing that jumps out at you. The second thing for me, and for you too, is substance misuse and the substance use disorder. And we've been working both. I think the thing to remember is that it's not just treatment, it's prevention to treatment and recovery. I mean, we have to be involved in all the ways, really trying to prevent substance use, and then also making sure there's adequate access to treatment.
Mm.
I think over the years, if you look at prevention, intervention, and treatment, we've built, close to 20 different programs. It's not a magic bullet.
Mm.
And it doesn't go away. All of these issues, mental health, food security, housing, substance misuse, strengthening families, dental care. It's not something that every third year we take a switch and we turn off the light on one assessment and then turn on it on the other. We have to build on what we have, because most of these problems don't go away. There's something that I'd like to say that people struggling with anxiety and depression, that it's gone away in 3 years, but that would be totally unrealistic. So we've got to build systems, and we do that not as the hospital alone, as you said. We do it with our community partners. You got me on a roll. So
yeah, no, it's great. It's great. Let me just kind of speak to that, the mental health piece as well, because that was the first thing that jumped out at me as I read the assessment. Over 50% of those people who filled out the survey reported some level of increase in stress or anxiety. And now the survey was done last year, 2021, primarily between April and July, right?
Right.
So that was when we were really in the thick of things, but it's still lingering. I'm sure the numbers are very similar now as they were back then. And what you also touched on was the substance use, right? In the isolation, folks weren't able to avail themselves of the support groups, AA groups or NA groups, or going down to Turning Point. So the numbers said, right, it was 39% increase in drug overdose deaths. It was one of the big numbers that jumped out at me as well.
Oh, it breaks your heart, really.
Yeah.
I mean, honestly, it does. It breaks your heart. Windsor County has, over the last 3 years, either the highest number of opioid fatalities, or now we're down to the third highest, but it's been ranging for the highest or the second highest, and that includes Chittenden County.
Yeah.
So it's really, and I have to say, we've done a lot. We've brought partners together from prevention and treatment and recovery. We now have recovery coaches that come in our emergency room 24/7. They'll come to help and stand by and walk the recovery journey with folks, get people into treatment programs. We have rapid access to medication assisted therapy from our emergency room, and Dr. Lord and Connecticut Valley Addiction Recovery has said, they'll see people either the same day or within 3 days. And we've made rapid access and into treatment a priority for us. We distribute Narcan. I want to say to anybody, that's listening to this, you could save a life with Narcan. And we distribute it free from our emergency room. Come up. Yeah. And, because we're all need to be involved. You just never know if you could make a difference in somebody's life, and you have to save a life before you can get somebody into treatment and recovery. So
those 3 areas, Jill: prevention, treatment, and recovery, right?
Yeah.
And it also made me think, because you mentioned Dr. Paris earlier, the CEO of Mount Scottney, and I remember hearing him say in one of our meetings that with mental health being such a critical issue now. And as you also said, it was a critical issue back in 2018. And I remember him saying, it's not like we've done nothing since 2018. We've been making some good grounds on with regards to substance use, those three areas. But across the board, he said, two things that stuck out to me that he said. One, we've been making ground, but COVID just kind of knocked us back, as it knocked everybody back.
Right.
But then the other thing he said that stuck out to me was, you speak of mental health, and it doesn't just mean adding psychiatrists or counselors. It's the broad range of services and ways of coming alongside people. And that's what, tying it back to the prevention, was it prevention, intervention, and recovery? When you hit all areas, then you're so my language, you're ministering to the whole person, right? You're coming alongside the whole person from beginning to end, and you're addressing various levels of mental health needs. So with the community health assessment, when we're trying to strengthen families, stronger families have stronger mental health. When housing is affordable housing leads to stronger mental. Every aspect, it's a web, right? Every aspect ties into one another, so we can work towards better mental health by addressing all these different areas.
Exactly.
Let me ask you a question. So kind of the takeaways I heard you say, it's data driven. It really touches in the demographics. It gives us, it highlights the mental health. It highlights substance use. What do we do with it now? Kind of what's a takeaway from some of this information that what happens now that we have this information? Where do we go?
So we have to have a community health implementation plan. And we have to, analyze the data and say, well, what do we need to do? And it doesn't, we have done this for a long time. And one of the things we do is build on, what we have built in the past. So, after 2018, we built a real network of groups who said, well, I'll work together for food security. I'll work together with you for substance use disorder. I'll work together with you, for strengthening families. I'll work together with you for housing. Those groups aren't going to go away. I think we have around 99 community partners that are already enmeshed in networks that have specific goals and have a specific research-based priorities and strategies that they're continuing to move forward. And then, the second piece is, well, we have to look at the gaps. Where are the gaps? What more can we do for mental health by bringing people together? And what can we do for dental health? Dental health, hey, by the way, the mouth is part of your body, and we have no dentists in the Windsor area. And so what can we do for dental health? And so there's some things that we can do in partnership, and will do. We used to be able to have a dental clinic in the school before COVID, and then COVID again, it wiped it out. So my hope is that we're going to be able to bring that back into the school and really build up some partnerships to be able to recruit and have more dental resources. But it's that with everything. And I think the key is that anybody that has something in their heart and wants to get involved would be welcome with open arms in our efforts. And so, I think that's one of the things where I wanted to be able to have this dialogue, is not only to get the word out. Oh, yes, we did it. We did the needs assessment, and here's the outcomes of the needs assessment. But also, I have found, over the years working in a, it's just a great appreciation for the people and the communities that we work with. So many good people want to and can make a difference. And so, I think it's getting involved.
Mm.
If it's learning how to, uh, what is that commercial that's on TV now that I saw that was Seize the Awkward? It's learning how to talk to someone that you're concerned about that may be going through depression or anxiety,
Mm.
or it's joining a support group, or going to a self-management program. I mean, we have a series of workshops for people with hypertension and diabetes, and the RAP program for promoting mental health, and tobacco cessation. Yourself, you can take care of yourself better, which, and make yourself and help yourself be healthy by working with some of these programs. Um, I'll give a plug for Volunteers in Action and all the great work that volunteers have done to help us through COVID, and also help us now with, with food security, delivering groceries, and getting medications at the pharmacy for people that are homebound. And it's
Yeah.
kind of countless. I have a lot of hope because of that, you
So
know.
what you're speaking to, Jill, are two levels of being involved that I'm hearing. One is, just on a community level, and that's one of the things that also jumped out at me from the community health needs assessment. Resilient communities, or when we have this sense that we're in this together. And again, we've been challenged in that way over the past 2 years, but I think we're coming out the other side. And I, like you, I have great hope for Windsor, my community, but also
Right.
just the greater area. I think it's one of the strengths of the small town life is that we have this sense that we're in it together. So all the more, as we emerge from the isolation, get involved, just connect with others, and be a part of life, do life together with one another. But the other thing that I also hear you saying is, specifically with regards to community health needs assessment, that we have these groups that are working together: senior health, and housing, and food security, and chronic disease, and alcohol and substance use, strengthening families, spiritual health that you and I are involved in. And we would love for others in the community to be a part of these, right? Here I am. I'm using the we, and I'm a part of the community. And I have to admit, I had to jump over my own shadow in being involved, and I had to learn the acronyms, and a lot of the stuff was just like way over my head. But over time, I feel welcome. And folks who are leading the different groups, I don't have a whole lot to say every time, but when I'm there, they invariably, I hear somebody say, "Thanks for being here, Pastor Paul." So I would just say that to the community. If you want to be involved, probably, if I may, get in touch with, they can get in touch with you. There's ways to serve the community on the frontline grassroots level, Volunteers in Action, but also at this level of these different groups that are working together. So I think that's one of the things that we can say, that where does it go from here? We're doing that work of these are our marching orders, and we invite the community to be a part as well.
Yeah, and everybody can make a difference. Everybody, we have people that, yes, are homebound themselves, but they make friendly visitor calls. They'll reach out and have a conversation and give support to somebody else. I think, everybody has value and brings richness to what we're doing. That's what community is. That's why I love this work. Yeah.
Yeah. Yeah.
Yeah.
Great. Anything else any one last word that you want folks to hear with regards to the CHNA, the needs assessment? Or
Yeah, just that we care. Just that we do believe, like, and it's, these days it's hard not to be enmeshed in all the negative that's going around, and I find in doing this work that it's very uplifting, because even though we're addressing some very terrible traumatic, you know, difficult problems, that if we can do it together and people know that they care about each other, that, you know, we can make a difference. And so I think, you know, taking hope in the face of the problems. And we like to build, you know, a strength-based approach. Let's not just look at the problems. Let's look at what some of the answers are and how we can be part of the answer. So, you know, that's, you know, pretty much. Yeah.
That's a good word. That's a good word to end on. Thanks, Jill. So
Okay.
hopefully this is giving folks an overview of this interview is giving folks an overview of
Yeah.
the needs assessment, what's happening in our broader community in ways that we're trying to address some critical issues. Thanks. Thanks for the time.
Thank you, Pastor Paul.
Take care.